What if I told you that $800 could be coming your way soon? That's right. Lawmakers have proposed a one-time payment specifically for Social Security SSDI and Medicare beneficiaries. In today's video, you'll discover everything about this potential $800 payment, who qualifies, why it's being proposed, and what it means for your finances. We'll also explore groundbreaking Medicare expansion proposals that could save you thousands on dental, vision, and hearing care in the near future. Stay until the end, where I'll share a completely free resource that could help you navigate over 20,000 Medicare plans to find the perfect coverage for your specific situation. Welcome to Financial Area, where we break down complex financial news into clear, actionable information. If this is your first time here, hit that subscribe button and tap the notification bell so you never miss our latest updates on Social Security, Medicare, and retirement benefits. In response to the growing financial pressures facing millions of Americans, particularly our seniors and disabled population, a group of lawmakers has introduced legislation proposing a one-time $800 payment to provide immediate relief. This payment would specifically target those receiving Social Security retirement benefits, Social Security disability insurance, and Medicare beneficiaries groups that have been hit especially hard by rising costs across the board. The timing of this proposal isn't coincidental. With inflation affecting everything from groceries to healthcare, many beneficiaries are struggling to make ends meet. The $800 figure wasn't chosen arbitrarily either. It represents an amount that could meaningfully help with immediate expenses while larger systemic changes are being considered. If approved, this payment would work similarly to previous economic impact payments, being automatically deposited for those who have direct deposit information on file with the Social Security Administration. To qualify for this proposed $800 payment, you would need to be currently receiving benefits from Social Security SSDI or be enrolled in Medicare. This includes retirees drawing Social Security benefits, individuals receiving disability payments through SSDI, and seniors enrolled in Medicare programs. Unlike some previous benefit increases, this payment would be the same fixed amount for all qualified recipients, regardless of your current benefit level or income. It's important to understand that this payment is still in the proposal stage. The legislation needs to move through committee reviews, gain sufficient support in both chambers of Congress, and ultimately receive presidential approval. While there's significant momentum behind providing this relief, the exact timeline remains uncertain. Based on previous relief payments, if approved, funds could potentially reach beneficiaries within 2-3 months of final passage. This $800 payment proposal exists alongside broader discussions about fundamental changes to our healthcare system. Perhaps the most ambitious of these is the reintroduction of Medicare for All legislation. This proposal aims to create a single-payer healthcare system that would provide comprehensive coverage to all Americans, essentially expanding the existing Medicare program to the entire population regardless of age. The Medicare for All plan would eliminate most private insurance and replace it with a government-administered program covering a wide range of services with little to no out-of-pocket costs for patients. Proponents argue this would simplify our complex healthcare system, reduce administrative costs, and ensure universal coverage. However, the proposal faces significant challenges, including concerns about overall costs, potential tax increases required to fund it, and the massive restructuring of our healthcare industry it would necessitate. Given these challenges, many healthcare policy experts believe Medicare for All remains a long-term aspiration rather than an imminent reality. Even its strongest supporters acknowledge that implementation would likely take years, if not decades. This leaves many current beneficiaries wondering what changes they might actually see in the more immediate future. A more practical alternative gaining traction is targeted expansion of existing Medicare benefits. Rather than completely overhauling our healthcare system, this approach focuses on adding coverage for services that have traditionally been excluded from Medicare. Specifically, there's growing support for adding comprehensive dental, vision, and hearing coverage to standard Medicare benefits. Currently, Original Medicare provides very limited coverage for these services, typically only covering them when they're medically necessary, as part of treating another condition. This leaves many seniors paying entirely out of pocket for routine dental checkups, eyeglasses, or hearing aids expenses that can quickly become unaffordable on a fixed income. The proposed expansions would change this by adding these services as standard benefits, similar to how Medicare covers doctor visits and hospital stays. Some estimates suggest this could save the average beneficiary thousands of dollars annually while improving overall health outcomes, as untreated dental, vision, and hearing issues often lead to more serious health problems down the line. While Medicare for All faces significant political hurdles, these targeted expansions enjoy broader support and could potentially be implemented within the next few years. The funding mechanisms being discussed include a combination of modest premium increases, adjustments to existing payment structures, and potential tax changes affecting higher-income individuals. Among these potential expansions, dental coverage represents perhaps the most critical need. Dental care in America remains prohibitively expensive, with even basic procedures often costing hundreds or thousands of dollars without insurance. For seniors on fixed incomes, this frequently means delaying or foregoing necessary care, which can lead to serious health complications. The current landscape of dental coverage for Medicare beneficiaries is also notoriously confusing. Some Medicare Advantage plans offer dental benefits, but coverage varies widely between plans and often comes with significant limitations. Standalone dental insurance for seniors typically offers modest benefits relative to premiums paid, leaving many wondering if it's worth the cost. Recognizing these challenges, some policymakers have proposed alternative solutions. One interesting approach under consideration is providing beneficiaries with special purpose cards specifically for dental expenses. These would function similarly to health savings accounts, but would be pre-funded by the government and restricted to dental care uses. This approach could provide immediate relief, while larger structural changes are being developed. While we wait for these potential expansions, it's crucial to make the most of options currently available to you. Many beneficiaries don't realize they have choices beyond original Medicare that might better suit their needs. Medicare Advantage plans, Medicare Supplement Insurance, Medigap, and prescription drug plans all offer different combinations of coverage and costs. The right choice depends entirely on your individual health needs, financial situation, and preferences. For instance, if you regularly take multiple prescription medications, finding a plan with good prescription coverage might save you thousands annually. Similarly, if you anticipate needing significant dental work, a Medicare Advantage plan with dental benefits might be worth considering, despite other trade-offs. It's also important to remember that you're not locked into your Medicare choices forever. Each year during the annual enrollment period from October 15th to December 7th, you can review and change your coverage options. This annual opportunity to reassess your needs is valuable, especially as both your health requirements and available plans change over time. Given the complexity of Medicare and the sheer number of options, there are over 20,000 different plan combinations across the country. Many beneficiaries feel overwhelmed trying to make these decisions alone. This is where specialized Medicare assistance becomes invaluable, and I want to share an incredible resource with you. There are dedicated Medicare assistance teams staffed by licensed specialists who can provide personalized guidance tailored to your specific situation. These experts have comprehensive knowledge of all available plans in your area and can help identify options that include the doctors, hospitals, and prescriptions you need at the lowest possible cost. Perhaps the best part? This assistance is completely free to use. These services are typically funded through the insurance providers themselves, meaning you get expert guidance without paying a penny. They can explain complex Medicare rules in plain language, help you compare plans side by side, and even assist with the enrollment process once you've made your decision. To connect with these specialists, simply call the number shown on your screen or click the link in the description below. Take advantage of this resource. It could potentially save you thousands of dollars while ensuring you have the coverage you actually need. So let's recap what we've covered today. A one-time $800 payment has been proposed for Social Security, SSDI, and Medicare beneficiaries to provide immediate financial relief during these challenging economic times. While this proposal works its way through the legislative process, broader discussions continue about expanding Medicare coverage, particularly for dental, vision, and hearing services that are currently inadequately covered. Though Medicare for All represents a bold vision for healthcare reform, more targeted expansions of existing Medicare benefits are likely to arrive sooner and provide meaningful improvements to beneficiaries' lives. In the meantime, taking advantage of free Medicare assistance services can help you navigate the complex system and find the best coverage for your needs.